Hey, what's up everyone? Today we're going to talk about common injuries that happen when we play hockey. In Minnesota, it's January, it's the best time to be outside skating around on lakes or rinks, and a lot of times people get injured when they do this, especially if we haven't played in a while. So let's dive into some hip related problems and as well as some low back related problems. Hip pain is probably one of the most common things I see with my hockey players, whether they're collegiate hockey players, professional hockey players, or just recreational players. Our hips are, it's a large demand that we ask when we are skating on a rink. It's maybe an unnatural motion for most of us. We don't typically stride out in that 45-degree angle on a daily basis. So when we ask our body and we ask our tissues to do this motion, sometimes they aren't ready for it and they may become a little sensitive when we do it. So how do I get myself out of pain, or how do I prevent from having these? Well, the first thing is, people always talk about stretching. Stretching doesn't really prevent injuries, but it does feel good sometimes, and sometimes it makes you feel kind of more limber and better prepared for the activity. Now, I don't recommend stretching like long, deep stretches before you play. That's been shown to actually decrease performance, but again, in a recreational athlete, not a huge deal, not significantly enough to be noticeable. But you can do it if it feels good. That's a step one. And step two, with prevention, the thing about it is I'd rather have you do some sort of warm-up. Instead of going like walking in and boom, hitting the ice and skating as fast as you can, maybe start nice and easy. Do a couple laps and kind of move around and get your stride feeling good and work on your edges and leaning back and forth, warming up those knees and ankles. Dynamic warm-ups have been shown to be much more beneficial in regards to helping to mitigate, I wouldn't say prevent, but helping to mitigate potential injuries on the ice. So that's kind of step one. And then step two, so let's say you didn't do any of that, you just jumped in, you started playing, and boom, or the next morning, all of a sudden you wake up and your hip flexors, the anterior, the front part of your hip is so sore, it's tired, it's from that lifting of the knee and pushing backwards. What do you do? Well, we always are worried about tendon issues in this area. Now, tendon is the part of the muscle that connects to the bone. It's what bears the most stress. And so when we're skating, we're asking a lot of our hips to push and stride back. Everyone should be able to do this. It's a normal fundamental motion in regards to just the simplicity of doing it a couple times. The problem again rises from the multiple times and asking our bodies to do it over and over and over and over again. This is where sometimes we fall into a little bit of a problem. Tissues become sensitive, and then what we need to do is find a way to get you out of pain so that you can keep moving. A lot of times when you go back to sport or do an activity that you haven't done in a while, our muscles ache the next couple days. We call this DOMS, so delayed onset muscle soreness. This is super common. It's not dangerous or pathological at all. Typically it lasts for 24 to 48 hours, and what we tend to see is that it's worse the second 24 hours of the 48, day two. It is something that you can certainly go through in regards to if you're doing an activity, you start an activity, the next day you wake up kind of sore, you certainly can go back into that activity. Their tissues are sensitive, they've been used, and what happens when we use our tissues, especially when we're talking about strengthening them, is we, microscopically, we break them down a little bit. That's what happens then when we build on top of them at a rest period, we get stronger and more robust tissues. So with hip pain, the first thing I like to do is try to use it and try to isometrically load it. And isometric loading means I want to use the muscle, but I don't want to have it go through like a full range of motion. A simple explanation is if I want to strengthen my bicep, a way to do it is to start with my arm in extension, which is elongated position of the bicep, and then I'm going to flex and bring it up and shorten the bicep. So we go from long to short. With tendon injuries, a simple and safe place to start is actually with isometric loads, which means instead of going long to short, I'm going to pick a spot, and it doesn't really make a difference where, and I'm going to pretend like I'm going to go through this, but I'm just not going to move. So I'm going to push up into my hand here, boom, and then hold this contraction. So I'm flexing my muscle, resisting this type of motion, but I'm not stretching or shortening the muscle. So simple isometric, you hold. So for the hip, and a simple example would be to sit in front with your knees facing forward. You're going to put your hands down on your leg and lift up your foot into your hands without lifting your hip high. Nice and gentle, you start with a little bit of resistance and then you slowly build your way up. Isometrics have been shown to decrease pain and tendon injuries, and have also been shown to be effective in regards to mitigating DOMS. So a simple, quick fix. People always ask, oh, should I stretch if I'm sore? Again, you can. Again, with stretching, it doesn't really show that we're benefiting the tissue. We're not changing anything. Stretching is actually as simple as we are telling our nervous system that it's okay and safe to reach in these greater ranges of motion. So at that point, you don't really need to worry about increasing your range of motion. You're wanting to feeling about this tissue, and it's not like we're stretching the tissue like it's Laffy Taffy or something, right? What we're doing is we're just allowing our bodies to feel more comfortable at greater ranges of motion. So going back to it, it's not stretching it out. That's not really what's happening when we talk about stretching, and all you're doing is increasing your nervous system's tolerance. Well, we don't really need to do that, so if it feels good, go ahead. If it doesn't feel good, don't do it. No right or wrong, I guess, in that scenario. Isometric loads are huge, and then gentle ranges of motion are huge. Let's say you had a hard game, you went out and played on the rink for the first time in a while, and you played a full game and you're sore as shit the next day, no problems. What you're gonna do is you're gonna get back on the horse. You're gonna go for a walk, maybe a bike ride. Maybe if you can get back on the rink or the pond, you can just gently skate around. So you're still doing the activity that caused the discomfort, but you're not provoking the pain. And that's key. So just a couple simple fix for hockey players with hip pain. Low back pain is gonna be along the same exact line. We wanna bend over quite a bit. We're asking a high demand when we're playing hockey. And all you need to do is find a position or find a movement that feels good and start to build tolerance in that tissue. I love deadlifting for hockey players. Strengthening their low back is very, very crucial, as well as strengthening their butt muscles, their glutes. So if we can strengthen those tissues, get more resilience and capacity in our low backs and hips, we'll be able to withstand the demands that we're asking for it to do, such as repetitive motions of skating over and over again and bending for an hour or a half hour or whatever it may be. And all these things are actually going to help us feel better, increase our movement, allow us to live happier, healthier lives. The more motion, the more it feels like lotion, right? So the better movement, the better you feel. All this is great. At SouthWest Chiropractic, I rarely will ever tell athletes or patients in general, stop doing the thing you love to do. I want you to move. I want you to feel good doing the movements that you want to do. And my goal is to get you out of pain temporarily using the skills that I have and have developed over the years on my table, and then allow you and give you tools so that you can get yourself out of pain and back to doing the things you love. Hockey, hip, and back pain is one of my specialties. I love hockey players. I was a hockey player growing up. If you have problems, let me know and let's see how I can help you.